All right, thank you again for joining. Today we have Margaret Howard speaking to us on sleep disturbances and Parkinson's. Margaret, if you've called into our InfoLine team, you've most probably spoken to Margaret. Welcome, Margaret, and thank you so much for taking time out of your busy day to present to us today. So I will hand over to you.
Thanks for joining us this afternoon. And look, it's really nice to connect some faces to names. So I have spoken to a few of you on the info line. So today's topic is sleep disturbances and Parkinson's. Researchers estimate that up to 2 in 3 people living with Parkinson's have had trouble sleeping at some point, and this can have a big impact on someone's quality of life. It can contribute to mood changes, feeling tired, affect concentration, impair memory, and can worsen fatigue, depression, and anxiety. So today we'll look at some contributing factors to disrupted sleep, strategies to help manage, and who to ask for help. Information discussed today is general in nature, so there'll be an opportunity for questions at the end, but I may need to ask you to call in on our info line so we can gather more information about your individual circumstances to be better able to answer your questions. Okay, so it's important to investigate the causes of sleep disturbances so they can be treated appropriately. So disturbances can be due to motor symptoms such as tremor, stiffness, and pain. There can be early morning dystonia, for example, waking up between 2 to 3 a.m. is quite common and can be due to wearing off of medication. There can be daytime sleepiness due to fatigue, and sudden onset of sleep can be a side effect of Parkinson's medications. They're more common with dopamine agonists such as rotigotine or pramipexole, and this can be dangerous if driving or operating heavy machinery. And just be mindful of this if you are starting medication for the first time. Disruption of the natural circadian rhythm or body clock can occur with Parkinson's. Adults over 60 are more likely to have advanced sleep-wake phase disorder, meaning you feel sleepier earlier and wake earlier than the average person. Normally, there is a balance between dopamine levels, which is higher in the morning, and melatonin levels, which are higher at night. It's helpful to get adequate light exposure in the day and darkness at night to help regulate this. And there are quite a few studies regarding the circadian disruption in Parkinson's, and also to do with thermoregulation or core body temperature. RBD or REM behavioural sleep disorder can be an early sign of Parkinson's and can occur for many years prior to a diagnosis. It can also be for an issue for partners where injuries can occur. I've had lots of callers who call in and say they sleep like a log and unaware they are acting out their dreams, but their partners do have a different side to the story. So have a discussion with your neurologist, as some medications, if suitable for you, may help, and this may include melatonin or clonazepam. Insomnia is a sleep disorder that causes problems getting to sleep or staying asleep. A cycle can develop when you become irritated, fed up, and anxious, and how are you going to cope the next day? These feelings can make you more alert and awake, and this can be the start of insomnia. So treatment can include cognitive behavioural therapy with a psychologist and short-term sleep medication. Sleep apnea is a condition where you temporarily stop breathing. The airway becomes partially or fully blocked. Symptoms can include loud snoring or choking noises when asleep and can cause excessive daytime sleepiness. You'll need to see a sleep specialist to help manage. And just important to note, with Parkinson's, obstructive sleep apnea is not necessarily linked to being overweight. Restless legs can be a common symptom of Parkinson's, but it is also a syndrome which is unrelated, and I'll talk more about this in the next slide. Nocturia is waking up with a sudden urge to go to the toilet and is an issue if you need to wake up more frequently than twice a night. Difficulty turning over in bed due to rigidity is a common complaint. And anxiety and depression can contribute to insomnia. It's important to manage these conditions separately. Medications can assist, as well as seeking help from psychologists or psychiatrists. So restless legs is an overwhelming urge to move your legs. There can be accompanying symptoms of burning, tingling, itching, or throbbing. It's more common in females if there's a family history, being overweight, and also aging, and can occur when resting, sitting, or lying down. It may be due to low iron or reduced kidney function. Now, advising your neurologist is important as moderate to severe symptoms can be treated with some Parkinson's medications, and other adjunctive medications can also help to treat nerve pain, muscle relaxants, or sleep medication. Other effective treatments include massage, walking, and stretching, and these can also be modified in a seated position if necessary. Using hot or cold packs, regular exercise and good nutrition is also essential, and avoid junk foods. So treats on top of a healthy diet is fine, and it's good to have a dietitian as part of your allied health team. Nocturia is the desire to empty the bladder once you've gone to bed and can be related to changes in dopamine levels or wearing off of medication. However, it's not always due to Parkinson's. Other causes can include side effects of some medications, for example, antidepressants such as SSRIs, diuretics or calcium channel blockers used to treat high blood pressure, or lithium tablets. It can also be due to bladder infections. Constipation can also contribute as a full bowel can press against the bladder. It also may be due to enlarged prostate or pelvic prolapse. And other contributing factors may be heart and kidney problems, poorly controlled diabetes, or swollen ankles. So it's very important to discuss with your GP or your neurologist to find the cause and treat appropriately. So helpful information to tell your doctor is how many times per night you wake, volume of urine, and diet and lifestyle factors. If it's due to Parkinson's medication wearing off, they may adjust the medication or the timing of the medication, and there may be medication suitable to treat bladder frequency, but it's not suitable for some people, particularly age, if you're a little bit elderly, and also because of side effects can impact you. For swollen legs or ankles, elevating legs when sitting or a short afternoon nap can help to redistribute fluids. Drink sufficient non-caffeinated liquids throughout the day, as concentrated urine can irritate the bladder. If there's only a small volume of urine each time you go, avoid getting into the habit of going too frequently. A normal bladder can generally hold 300 to 400 mils of urine, and overnight 800 mils. So you can seek advice from a continence nurse specialist to see if bladder training is appropriate for you. Practicing specific male and female pelvic floor exercises may help. And more information on this is available on the Continence Foundation Australia website, or you can phone in on their helpline. An overactive bladder and urgency incontinence may be treated with Botox injections if other therapies are not successful. And in some cases, you may need to be referred to other specialists to investigate the cause. Turning over in bed can be difficult due to muscle rigidity. Satin bedding and PJs can be helpful, but perhaps avoid using both at the same time in case it becomes too slippery. Physios can recommend specific exercises for turning over and how to get out of bed. A slightly firmer mattress or one which has firmer edges can make it a little bit easier. And an occupational therapist can advise on the right bed height, mattress, or railings. Bed height will be different for everyone, but as a general guide, you want to be able to sit on the edge of your bed with your feet flat on the floor and your hips at least the same level or slightly higher than knee height. Bed rails may also help so that you can use your upper body strength to assist in turning over. If you get sweaty or hot at night, a mattress topper with cooling properties may help you to sleep better. Keeping a sleep journal for 2 weeks can provide your GP or specialist with accurate information about your sleeping patterns. Make a note of the symptoms that are affecting you and the time they occur. Important information includes the time you go to bed and when you get up, how many times you wake up during the night and why, how many hours you sleep. Keep track of the caffeinated beverages you drink, both how many and at what time of day, if you take naps, and your exercise routine. These notes will help you have a productive conversation with your doctor about your sleep patterns. Partner observations are also important as you may not be aware of certain symptoms such as snoring or REM sleep disorder. Some supplements may be helpful such as melatonin or magnesium tablets, but please consult with your GP or specialist first to see if it's suitable for you. And just caution with some over-the-counter preparations due to potential interactions. For example, some containing St. John's wort or older generation antihistamines. If sleep difficulties are due to Parkinson's symptoms or medication wearing off, slow release formulas may be prescribed or patches may also be helpful. Sleep medication is only useful for short-term use, generally 3 to 4 weeks for insomnia. It does need to be tapered down to reduce rebound effects, and be mindful it can cause hangover, drowsiness, confusion, and affect memory. So some management tips. Caffeine has a half-life of approximately 6 hours. So as a minimum, avoid drinking 3 to 4 hours before bed, and this includes tea, cola drinks, and chocolate. Avoid alcohol 4 to 6 hours before bedtime. Avoid vigorous exercise 2 hours prior to bedtime, and avoid use of devices such as phone, tablets, watching disturbing content on television. So here are some reminders you can put into daily practice to help improve sleep. So remain active, exercise regularly during the day, sunlight and fresh air, getting into nature, catch up with your friends or join a peer support group, power nap in the early afternoon, which is prior to 3 o'clock, and keep it to approximately 30 minutes. A lighter meal or gentle walk after dinner can also aid digestion. Establish a good sleep hygiene by keeping a regular routine. So develop a ritual to wind down, example, a warm bath or shower 1 hour prior to bed, and allow time for body to cool down naturally. Or you can take a cool shower if you have difficulty managing your body temperature. Ensure your bedroom temperature is comfortable, not too hot or too cold, and reduce noise and light. try relaxing activities and work out what works best for you. And this could include reading, deep breathing, meditation, or listening to music. And there are free apps such as Insight Timer or Spotify with guided meditations you can download on your smart device. And see a sleep specialist if you find your medication or modifications to your lifestyle aren't working. And so the key message is to work out specifically the cause or causes of your disrupted sleep so it can be managed appropriately. And I just wanted to finish off with our 4 happy hormones chart. So you can start some new habits to help you enjoy life. And more information is available on our website.